They were both studies that fundamentally ask a question in patients with resected stage 3 disease: is there a benefit to adjuvant radiotherapy? The Port-C study failed to show a disease-free survival benefit or an overall survival benefit, but they used techniques of radiation called 3D conformal radiation in 89% of patients that are not techniques that we use routinely today. These are techniques that would increase the exposure to normal tissues, including the heart and the lungs. And so when you dive into the lung art data, it would appear that the lack of benefit was in part driven by increased risk of cardiovascular events, in part because of this inferior technique of radiation. The Port-C study was a study that did use those more sophisticated intensity modulated techniques. The problem with the Port-C study is that 24% of patients who were randomized to receive radiation didn't receive it. And so when you have a study where a quarter of your patients are not abiding by protocol, the data then becomes challenging to interpret then. In the Port-C study, if you looked at how patients were randomized and their outcome, there was not a benefit. But when you look at the actual treatment given, there did seem to be a benefit to post-operative radiotherapy. Additionally, the Port-C study included patients that were treated with intensity modulated radiation 90% of the time, a much more contemporary form of radiation. So how do we put all these data together? Because the data are kind of pushing in different directions. Well, I think right now, based on the randomized data we have insufficient data to guide the routine use of post-operative radiotherapy in this setting. That being said, there are a subset of patients that probably do benefit from radiation, and further studies will sort of help us understand who those patients are.